I have the book right here. It's called Why God, Suffering Through Cancer into Faith. And the cover, I should note, is a picture of me in treatment with a friend. So here's me, the crying one at the bottom, the bald one. Here's the other bald one. This is my friend Odie. So Odie was 13. I was 19. So he was sort of like a little brother figure in treatment. And he was one of the kids I met in the waiting rooms who encouraged me a lot. Odie knew that he was going to die for a long time. And when I met him, I remember him telling me that he was probably going to die. And even though he was only 13, he was wise beyond his years, and he taught me a lot. We spent a lot of time together, and I wanted to put him on the cover because we became so close. And I got to have a really special conversation with him when he was in the hospital, probably like a few weeks before he died, because he eventually went home on home hospice. And before he went on home hospice and was in the hospital, I went to visit him. It's one of these situations where like patients aren't supposed to go in other patients' rooms because of the germs. And he had some infection. So I was like wearing a gown and a mask and all the stuff and gloves. And they were like, she can go in, but don't tell anyone. My doctor was like telling the nurses, just ignore it. Pretend you didn't see it. So they let me get in there with him. And I sat by his bed and talked. And I think it's in the book. But basically I told him that I was so glad that I got to meet him and be friends with him. And he said that getting to be friends with me and know me was so worth it, that he wouldn't take back the cancer, that it was so special to be friends. And I said, I really always going to try to help kids like you. And I just remember that he said, well, first of all, he told me to stop crying. I was the one crying here. He's the one dying. And he told me, I know you will, Maggie. I know that's what you're going to do. And so when I think of him, I imagine that he's like sitting there just nodding and being sure that he knew all along that this was what I was going to get to do. I don't think about him every day, but I think about him often, especially when I'm thinking about other patients that don't get to survive. And it makes me just really want to like live and like make every day meaningful, take care of people with my whole heart, put everything into it. And, I don't always get to make giant changes. Like I'm probably not going to be someone who cures something, like cures cancer or cures a type of cancer from my research. But I know that sometimes being there and having a relationship is what people need the most. And I feel like that's the part that I know that I can do.